start with the need for this intervention, the ultra brief therapy for psychotrauma. What's the need for intervention generally in trauma care? We all know that the problem of psychological trauma is global and the impact is wild. The footprint of psychological trauma is bigger than the actual cause of it. And that's why psychological trauma, is understood as the challenges, the suffering that follow the cause of the trauma. We'll explore further to understand more about this in Module 1. But in order for us to see why do we need this ultra brief therapy for trauma, and these are part of the reason why we need it. First is the current tools we have for trauma interventions, especially in the psychotherapeutic aspects, are broadly grouped into two. We have the supportive and we have the conventional psychotherapy. The supportive are usually looked as level one of support. And here we have things like psychological first aid and mental health first aid. Uh, Psychological first aid provide the immediate safety, stabilization, and non-intrusive support. And it's basically work on you look, you listen, and you link. So you look at the person suffering, you listen to their suffering, you give them succor, you give them support, you stabilize them, and you link them with further help so that they can receive more healing in the process. Why mental health first aid work through the acronym called ALGI, where you approach, you listen, you give reassurance, you encourage for them to seek professional help, and you encourage them to seek self help and we need support group activity. And in this sense, this level one of supportive actions are not therapy per se in themselves, but they are form of psychological intervention needed for crisis response. They are structured, but not they are not structured in the form to bring about healing, but they are structured to bring about reduction in the immediate after effect of the cause of the psychological trauma. And based on the way they have been designed, we realize that from there, the linkage or you encourage person to see professional is for the person to go and get the conventional psychotherapy from there. An example of such that has been designated for trauma is cognitive processing therapy or CBT, trauma focus, or prolonged exposure therapy among the many psychological interventions that have been earmarked for treating psychological trauma. There are a lot of evidence for them. They are highly effective, structured therapeutic models for trauma. They are practical, but to offer them a crisis setting is very challenging. In addition, they also bring more trouble because they are not something you can give over a short period of time. They are something that you need minimum of about 12 sessions for one to carry, and the resources needed for one to do this is not limited. So, I mean, the resources are unlimited. So, and because of this, it takes a lot of training, a lot of effort, a lot of sacrifice in order to be able to acquire these skills and be able to move forward on this. So, it is based on this that we need to build our skill in psychological intervention. But looking at these two formats of psychological interventions, is that to emphasize the level one type of psychological intervention are usually supportive in action, and but we from there we seem to jump to much a higher level, which we arbitrarily call level three, which are the conventional psychotherapy. And based on this call that there is a need for more to be done in order but to be able to, and that leads to what we call the intervention gap. The intervention gap in trauma calls that we need an intervention between the immediate stabilization and triage that is usually done with the aid of psychological first aid and mental health first aid. And before people move to the long-term recovery and integration, there's need for an early and healing therapy. And that gap is pressing it, and that is that we need a more feasible than the long-term therapy. So this gap is what the therapy, this training is about, the ultra brief therapy for psychotrauma. By definition, it is a structured, manualized 5 session therapeutic program designed to address the immediate need of individuals experiencing psychotrauma. It is positioned as an intermediate therapy on the continuum of care between the stabilization and the brief psychotherapies, which are the long time supportive. So we need something in between there. And the core principles are based on trauma education, enhancement of hope, cultivation of wisdom, and teaching of coping skills so that the individual can recover from the trauma, stabilize it, and reduce the psychological distress and promote recovery as the goal. So, why is it necessary that we emphasize the need for psychological first aid and mental health first aid as tenets which are essential for this therapy? And since they are the foundation, this therapy builds upon them because the alternative therapy does not replace these basic stabilization psychological techniques. It does not replace them, but it builds upon their foundation. Because, for instance, we know that the two are supposed to serve as first aid, to stabilize first, but that's also part of what the ultra brief will do. Why the psychological first aid look and listen aspect of it is similar to some of what will be done in the first session, where we have to dedicate it to building rapport, understanding the patient's psychological distress, and that way we try to mirror the non-intrusive and compassionate listening, but in a more holistic and a more in-depth way than what the psychological first aid or the mental health first aid provide through their approach. And when we look at the psychological first aid link, which is the third aspect of doing psychological first aid, they provide that through the therapeutic contract that is signed, the engagement that is there, the that therapeutic milieu that is created, and it helps to provide immediate safety and resources that is needed. And that way is able to link to with the approach, the assess and assist aspect of the mental health first aid, which helps to give the coping that the this therapy we are going to learn more about is going to provide. And that is why it is crucial for ensuring safety and assessing for immediate risk in the patient or in the client as we look at them. So the alternative approach overall is to be able to help us to link so that we can be able to provide a structured recovery plan. And it introduces therapeutic goals out and outlines that are expected outcomes for the individual to recover, giving the individual an active role to play in their healing. Why these basic things are some of what psychological this therapy will do, it does them in a more in-depth and add more to them. That's the key takeaway. And the key takeaway is that the ultra brief therapy begins the healing, not just trying to stop the suffering and the bleeding, the superficial uh, um, trouble that surrounds the trauma. No, not those superficial uh, suffering that we can see that the individual can say, I'm going through this. But it helps to the individual to start beginning the healing process. So that the individual can apply some more in-depth psychological frame that will help the individual to enhance their hope, cultivate more wisdom towards healing, and that will help them to be able to establish safety and build more rapport in the process, more in depth than the psychological first aid and mental health first aid that provides. And what are the evidence that this therapy works? And the evidence is there. There is a publication on grant and is a rigorous control pre-test post-test comparative study which was conducted in internally displaced person camps in Katsina in Nigeria. And there are two groups. The intervention group receive this therapy, and the wait list group, which later receive it after collecting the data from the research process. And we found that the intervention does reduce the trauma challenges that they face there. Their trauma recovery score increases significantly. Their PTSD, which is a 8 item scales score, also decreased drastically by about 50% in those that receive this compared to the control, which is about 10%. and it significantly enhance their hope. And we know hope is essential in all form of treatment, whether we are using pharmacological or non-pharmacological approach. Hope is very essential that the person we are treating have that I'm going to get well. So, and this therapy does that, and it also enhances the wisdom of the individual while improving their overall coping strategy. So, in conclusion, the evidence shows us that the ultra brief therapy is a proven effect and practical intervention that is very helpful to help individuals who serve as the frontline and other healthcare providers in a resource limited, crisis prone area. So, why do we need to acquire these skills? And I'm sure we know why. That's why we are all here. And so that, and these skills were able to fill a critical gap that is missing in our many repertoire of helping many different individuals and patients and clients that have come to us that need this intervention, and they need beyond the first aid which we usually provide. And the attributes also provide a task shifting for us so that we can also, when we learn the more in-depth psychotherapy, we can train other people under us to be able to learn this so that they can offer some intermediate therapy, while those that did not respond, we can now take, do the more in-depth one for them. And who can be trained? Anybody that have at least 14 years of education, that is the secondary school, and at least 2 years above that. And I know anybody who's a doctor, nurse, allied health workers, they all meet this criteria. But there may be some people who are interested in trauma, and they may fall among the chaplains and others. So that's why this criteria is very essential, that we see that they fulfill this before they are trained on this. And one essential element about acquiring this skill is supervision, because the delivery is most effective when people are trained and supervised. So when people are going to, and that's the essence of the 1 day practicum we want to do, so that to provide a baseline for individuals to be able to apply it and be able to utilize it, and also be willing to work under supervision as they work with several clients or patients they will see receiving this. There are some important things that we felt we should take note of. That this therapy is not like those in-depth psychological therapy, because it is distinct modality on its own. It's not a short form of any of those recognized therapy, whether it's cognitive processing therapy, whether it's CBT focus therapy, whether it's prolonged exposure therapy, and any other form of therapy we want to use, because this is unique in its own, and it's therapeutic uh, powers, or the drive of it is being able to activate the cultivation of hope and wisdom as the primary pathway to recovery. This is very essential, and these are also part of what has been addressed in the published work. And the beauty is also that it's culturally adaptable. The model is designed for flexibility. The training emphasize that we're going to go through emphasize that we need to also be cautious and courteous with the individual we're with, so that the language you use, the metaphors they use, and our understanding of the local idioms of distress are well respected and utilized in order to be able to help the client conclude. So this introductory part is just supposed to tell us that this therapy is not just what we are trying to treat for the sake of, it's coming to fulfill a missing gap that existed in the milieu of psychological intervention that exists to help individual that is going through psychological suffering. And it is an evidence-based 5 session treatment. Its proven efficacy has been identified through studies, and it is designed for you, because all I believe all of us that are here who are in mental health and related fields are frontline providers, and that way we'll be able to provide effective care for people that need us. This is the first part of today's session. Then, before we go to module 1 of this session, so quickly, if there are questions, I want to thank you for being patient with me, so that before we go to the module 1 to introduce us to lay the foundation for this. Thank you very much. Please, Prof, over to you, sir, before we go to the module 1. Thanks, sir.
Um, Before I go on, I think I still insist that we confirm that we've done and submitted our pre-test. Why this is important is we expect a certain level of knowledge from every person participating. We're going to do a post test at the end of the lecture series, and only those who've scored up to 70, 80% will be allowed to go into the practicals. The others would have to do remedial and do some other tests to be sure that they have the knowledge required. So people who don't have the time to go through and do all the things, it's a pity we will not be able to allow them to continue. That's why I'm insisting so much on. So please, those who've not submitted their pretest will not be given the link for the next lecture will not be shared with them. We need to be sure people have done their pretest, and then we certify them really fit to sit down in the class. Yeah.